Welcome to my weekly Sunday 9 p.m. live video. I am Dr. Tan Yiping, consultant obstetrician and gynecologist, and today is the first video of a series of videos that is all related to endometriosis. Previously, I had already had a few videos on endometriosis, and if you want to know more on basics about endometriosis, the reason why you get it, and all the basic things about endometriosis, then please go to my YouTube channel. My YouTube channel is in the link on this post. Go there, subscribe to my YouTube channel, and go through the videos that are already there. There are quite a number of endometriosis videos already. But for this particular series, I'm going to do a slightly different approach, because I have been having videos whereby I am the one who think what you should know and what I want to tell you, but I don't really know what you really want to know. So that is why 1 month ago, I actually posted up a post on my Facebook as well as in the support group Endometriosis Malaysia. And I want to thank all of you who have actually posted quite a number of questions out there. So I'm going to take a few weeks to answer all your questions, okay? So it's all going to be on endometriosis. Today is the first video and will go on every week until I finish all the questions. And of course, if you have any questions you want to ask me today, feel free to just put it in the comment section and I will answer you before the end of the video. Okay, so just to recap, what is endometriosis? Endometriosis is a disease whereby the endometrial lining of the uterus has already gone to a different place, because we call it as ectopic growth of endometrial lining. That means the endometrial lining, which is supposed to be in the center of the uterus, has now gone to another place that is no longer in the center of the uterus. It can go to any other parts of the uterus: ovary, fallopian tubes, fallopian tube, cervix, vagina, bowel, urethra, bladder, anywhere. In fact, anywhere. I've seen it almost everywhere. I've seen it on the liver, in the lungs, in the heart. So basically, endometriosis can go anywhere. And because endometrial lining is something that grows every month and passes out during our menses, but endometrial lining that is growing anywhere else, it will still grow every month together with your menstrual cycle, but it is unable to pass out. And because it cannot pass out, it becomes something that is abnormal and continue to grow and grow and grow over time. So what are the few problems with endometriosis? Number one is, of course, we all worry about cancer change. But cancer change, although it is a very big thing, but it is not so common. Endometriosis is quite common. It's about 20 to 30% of women. So 20 to 30% of women have endometriosis. So it's very common. But very rarely does it turn into cancer. So most of the time, it doesn't become cancer, although it can, but it's very rare. So even though it's a problem, but it's not really a problem that affects a lot of women. Women suffer more from endometriosis mainly because of two things. The two common problems. Number one is the pain. Some women have horrible pain with endometriosis. Really horrible pain. Pain that nothing else can help them. Painkiller doesn't help. They cannot go to work. They have to take MC. And it's a very horrible pain. And the other situation is when they cannot get pregnant. When they cannot get pregnant because of endometriosis, a lot of women actually reach a dead-end road, and they are very devastated. They do not know what else they can do, because they can't get pregnant and they want to get pregnant and they don't get pregnant. You know, there are a lot of implications for not getting pregnant. So these are the two main big problems with women with endometriosis mainly. Of course, other than that, because of the spread of endometriosis to other parts of the body, it does give itself some problem, like the kidney may die off because of endometriosis. You may not be able to breathe every month you have your period because it has gone to the lungs. But having said that, these people with such extraordinary type of endometriosis are actually very, very rare. So mostly people are still suffering because of the pain and also because of unable to get pregnant. So I'm going to go through some of the questions today. I see how many questions I can go through, and then we will continue with the rest on another week. Okay. So the first question, okay, I'm going to go through the questions that are from my Facebook first, not that many. Then I will go to the ones that was posted on Endometriosis Malaysia. So the first question is from Adiba Mutalib. Adiba Mutalib asks, can endometriosis be detected by MRI scan? I roughly know why she asked that, because I have also posted up many times in my Facebook, in my articles, in my videos. I always like to describe endometriosis as an invisible disease. Why I say invisible? Because I can't see it. Very often we can't see it. Endometriosis, we know, is due to the lining of the uterus in a different place. And this lining on the uterus, when it grows in somewhere else, sometimes it's just little spots, it's just little spots that could be just like 2 mm, 3 mm. It's just 2 to 3 millimeter. It's so tiny. It's so tiny. Even if it's 5 mm, 4 mm, it's still very tiny. And because it's so tiny, it's really very difficult to see it on ultrasound scan. So you see, typically, most of us, when we go and see gynae, we go and see gynaes do ultrasound scan. That is a typical thing we will use. We rarely send you for CT scan, MRI or whatever scan. We always tend to do ultrasound scan because that's what we have in our clinic, all of us. And very often when it's so tiny, you can imagine that a uterus is about 6 to 7 centimeter long. But on our ultrasound scan, we see only 2 to 3 centimeter long. The image is so tiny, but it is representing such a big object. It's a 7 centimeter object, but on my TV, I may not get it as 7 centimeter. So let's say I enlarge it, maybe I can see like 4 or 5 centimeter. A 7 centimeter now only look like 4 centimeter on the ultrasound scan. Can you imagine the 3 mm, 3 millimeter endometriosis spot would just be like 1 or 2 millimeter on the ultrasound scan? How to see lah? Cannot see lah. So endometriosis, typically when it first starts, it is all just little tiny spots. And these little tiny spots you cannot see. You need time, many years before this little tiny spot grow into something big. Maybe it grow as a cyst, or maybe it grow into a growth like a fibroid. Because endometriosis in the ovary, it can form a cyst if you keep long enough. So then you will see the cyst. But in the uterus, it will form something like adenomyosis or adenomyoma. These are the things you can see on ultrasound. But it takes many years to reach there. Many years. And that is why most women at the very early stage of endometriosis, they don't know. Why is it a problem when you don't know? It's because of something very simple. You suffer, you have pain. You go and see doctor say nothing wrong with you. You go and get an ultrasound scan nothing. I want to tell a story. It's one of my nurse. It doesn't work with me, that work in the hospital. One of my staff nurse that work in one of the hospitals that I go to, Sunway. And she tell me this story. That is her story. She always have this very bad pain. And as a staff in the hospital, you have to see the medical officer first, the MO first. So whenever she go and see the MO will send her to do ultrasound scan lah, MRI scan lah. And then nothing, but she's in pain. And the doctor say nothing wrong with you because ultrasound is normal, MRI is normal. All the scans are normal. So she suffered in pain for 1 year, 2 years, 3 years. And then After that, she got married. Then of course she got married. After another year, 2 years, she cannot get pregnant. So when she cannot get pregnant, you know, when fertility is not covered by hospital, you see because hospital cover them for their illness, so that's why she went to see a MO. You must see a MO first, the medical officer in the hospital. If the medical officer say you need to go see specialist, then only you see specialist. But because MRI scan is normal, ultrasound scan is normal, so the MO say nothing wrong with you, so there's no reason to see a gynae. So, but then when you cannot get pregnant is fertility. Fertility is not covered by hospital, not covered by your employer. So she went on her own to go and see one of the fertility doctors in Sunway at that time. And this fertility doctor say, you need to do a laparoscopy. Then so she went and did a laparoscopy. And there was so much endometriosis. I don't know how much, but the way she described to me is that she got so much because when the doctor recorded the video for her, when she watched the video, she said her eyes was crying. She had tears coming out from the eyes. She was so sad to see her pelvis got so much endometriosis, and yet for so many years she has been going to see the MO so many times because of her pain, and yet nobody sent her to see a gynae. The husband also was so furious. I mean, so many years you have been suffering, and why your MO never sent you to go and see gynae? And anyway, that also she discovered only in a laparoscopy. That's why if you just simply Google endometriosis, what is the diagnostic test for endometriosis? Diagnostic test for endometriosis is laparoscopy. You need a laparoscopy. Basically, you need a surgery to know whether you have endometriosis or not. You need a surgery to know whether your endometriosis is mild, moderate or severe. So that is why it is a problem. We know that most women, by the time somebody tell them that they have endometriosis, the average number of years is between 3 to 5 years. You need to see doctor for at least 3 to 5 years before somebody will tell you, dear, you have endometriosis. That is based on study. Because it takes 3 to 5 years before somebody detect that, confirm and say to you that you have endometriosis. It's either somebody who asks you to do a laparoscopy or some doctor who sees so many endometriosis, and when she sees you, he already suspect that you have endometriosis. If not, if you see a doctor that never see much endometriosis, he or she may not suspect. And when I talk about doctor, I'm not just talking about MOs and GPs, I'm also talking about gynaes. So very often these women, they go and see. It doesn't matter which doctor. They go and see, and initially the doctor may not say that it's endometriosis. Maybe you keep going or changing doctor and going, and after many years, one day somebody will say you have endometriosis. So the average years to diagnose endometriosis is 3 to 5 years after you first go and see doctor. So not to talk about how many years you have had pain and you haven't gone and see doctor. So most women also suffer between 1 to 2 years before they start seeing doctor. And after they see doctor, they need another 3 to 5 years before the doctor tell them, hey, you got endometriosis. So it's very sad. It's very sad. So haven't finished this story. So the fertility doctor saw the endometriosis during the laparoscopy and got it removed. Well and fine. And she conceived. Good news. She got pregnant, she gave birth, that's the good news. Then after that, what happened? After she gave birth, about a year or so, then she started having this pain again. And she's still working in some way. So when she has this pain, she went and see the MO again. And same story repeated all over again. Even though in her record already written there, she had a laparoscopy and endometriosis was found. Again, the MO say, there's nothing. Ultrasound, nothing. MRI, nothing. No need to go and see gynae lah. So sad. She's so sad. Because if she go and see a gynae, she will have to pay on her own. Because if the MO never sent her to the gynae, then it's not covered by employer. So you see, this is, I think, the biggest problem in endometriosis. The biggest problem in endometriosis is late diagnosis. Why late diagnosis? Because many doctors do not realize that your pain is due to endometriosis. And many doctors also do not realize that you are not pregnant because of endometriosis. So as a result of that, it kept delaying. So I have this case that I operated a couple of months back also. She had been trying for like more than 10 years trying to get pregnant. Seen so many doctors everywhere. IVF also done, everything done. No baby. And then when she came to see me, for other reason now, she came to see me because she was having a fibroid. She actually has quite a big fibroid and she was starting to bleed. So she's already in her 40s anyway. So I said, you need a surgery because you're having a big fibroid, and you're bleeding, so we need to do a surgery. So we did a surgery, but 10 years back when she was in her 30s and 20s, she don't have this fibroid, she only have it later. So fibroid is not the reason why she did not get pregnant. So when I did the surgery for her fibroid, then I saw one big rectovaginal endometriosis. One big chunk there, it is rectovaginal. Rectovaginal endometriosis is one endometriosis that's very hard to detect on ultrasound scan. And as a result, when I look at her, when I do surgery, I was like, just in my heart, I told myself, no wonder she was never pregnant. No wonder she couldn't get pregnant. Because nobody noticed she has rectovaginal nodule, rectovaginal endometriosis. That is why she didn't conceive. So there are many cases like that. I also had one that this lady I also always like to mention is because she also more than 10 years not pregnant, and now she's also in her 40s. All she did was company pay her for her medical checkup, so she went to Sime Darby Hospital and have a full medical checkup. And then surprised when she did her full medical checkup. Why? Because one of her kidney already shrink. Then she's like, why shrink? Then they scan head, scan tails, do MRI, do ultrasound, do everything. Cannot find out what made the kidney shrink. So the urologist said, I think it's a gynae problem, because the urologists know a lot of time endometriosis can kill the kidney. So the urologist say, go and see the gynae. You know, she's also see a very good gynae. The gynae didn't say, oh, scan nothing lah. No, she didn't. She already told her most likely you got endometriosis too. Even though ultrasound no endometriosis, MRI no endometriosis. But when your kidneys just die for no reason, you need to think about endometriosis. And this lady also, at that time she couldn't accept it, you know, because your kidney died. And she told me, it's not that I never seen any gynae before. I've seen so many gynae. You know, I can't get pregnant. I go and see so many gynae. IVF also done twice. Why is it that nobody know that I got endometriosis? So the answer is very simple. It's because endometriosis, like in her case, even after the kidney is dead, you can't see it on ultrasound still. You can't see it on MRI still. So that is why I say that endometriosis is an invisible disease. You can't see, invisible, can't see. So you need to be suspicious. You need to be suspicious. When you have symptoms of endometriosis, you have pain, you have any sort of pain. In fact, I say any sort of pain. Pain can be any type of pain, because depending on where your endometriosis goes. Endometriosis in your uterus cause you period pain in the center. Endometriosis of somewhere on the right side, your pain is on the right. Endometriosis somewhere on the left, pain is on the left. I always tell people, if your period pain is on the right or the left, you are endometriosis. That is not period pain, because period pain is from the uterus, so it should be more center. But having said that, even adenomyosis, that means endometriosis in the uterus, can also cause pain in the center. But once your pain is on the right, on the left, that is endometriosis. Once your pain goes down into your leg, that is endometriosis. You have thigh pain, knee pain during period, that is endometriosis. You have backache during period, that is endometriosis. You have pain when passing urine during period. That is endometriosis. You have diarrhea during period. That is endometriosis. You need to think of endometriosis whenever you have any form of pain. Tummy very bloated during menses. That is endometriosis. Gastric pain only during menses. That is endometriosis. Why gastric pain only during menses? Gastric, nothing to do with menses. You have pain when you breathe during menses. That is endometriosis. Any pain you have during menses, anywhere uncomfortable during menses, that is endometriosis. So you need to suspicious, you need to think, I may be having endometriosis. And as I mentioned, many of you, if you go and see one doctor, two doctors, a lot of doctors will say you're normal. The doctor say you're normal, it's okay. Tell the doctor, bye-bye, I see another doctor. See another doctor, another doctor, another doctor, until somebody confirm you have endometriosis. And how to confirm whether you have endometriosis? The one way that's 100% to confirm is laparoscopy. But, I want to say but, because that is conventionally, and that is what we always think. But there is something that came up the last 5 years. Something that came up the last 5 years. We call the IDEA scan. IDEA, ID, I don't know how, it's IDEA, but it's in capital IDEA. There is an IDEA trial. This IDEA trial came up because a lot of people are very desperate. How to find endometriosis? Do we really have to do surgery to go and find it? Because we know now, endometriosis, we can give you treatment by tablet. I got medicine for endometriosis. But then I want to diagnose you first before I can give you medicine, right? And then to diagnose, I have to do a surgery, I have to do a laparoscopy. Is there a way? I don't want to do a laparoscopy, but I want to see, to confirm your endometriosis. Is there a way? And somehow somebody, a doctor went to find, crack his head, scratch his head, he find many ways, and finally he found it. And this is what that is published in the IDEA trial. So if you Google endometriosis, IDEA scanning, and then you will see all these things, but you probably don't understand, but there is such a thing. So when this thing came up, it was only the last few years. Before the MCO, I can't remember exactly when, I think it's 2019 if I'm not wrong, I went to Hong Kong. I went to Hong Kong for an ultrasound conference, and there was a workshop on this ultrasound for endometriosis. And that is when I went to there with my sonographer. And there were so many workshops, there was like so many workshops, and we wanted to attend everything. So this ultrasound, I sent this endometriosis, I sent my sonographer there, and then for myself, I went and listened to another workshop. So we went to different workshops so that we can share with each other. So my sonographer went for some, and I went for some, and then that was the first time we were exposed to this trial. We know a bit from the trial and the conference. The conference also did mention certain things, and as a result, I learned a bit as well during that time, but not a full one. Until last year actually, Australia Society of Ultrasound Medicine actually organized one full workshop that was like run over a couple of days, and fully on this IDEA scan. And then we attended again with my sonographer. So since the middle of last year, we have started implementing this deep endo scan. We have started implementing this deep endo scan in my clinic, and mainly done by my sonographer, because she has attended twice. She has attended 2 workshops altogether on this topic, and so it's mainly done by her. And so far, it has been very accurate whenever she tells me there is endometriosis seen on this deep endo scan. And when we do surgery, the results seem to match. So what is deep endo scan? Deep endo scan is no big deal. It is just an ultrasound scan like you get from any gynae. Every gynae knows how to do ultrasound scan. Every gynae has an ultrasound scan machine in the clinic. The question is whether that gynae knows how to find the deep endo. That is the only difference. So because this is a new thing, it's a very new thing, and if you look at a lot of the new conferences that are running around Malaysia, overseas, not Malaysia, but more of the conferences are overseas, a lot of people are now talking about this scan. It is something very new. Even in the world, it is still only these few years that people are running workshops and teaching. I think it will take quite a long time before every single gynae in Malaysia knows how to do it. It may take another 5 to 10 years. Okay, because I've been working for almost 20 years, I realized that it takes almost that amount of time before everybody start doing it. Because there are a lot of other scans also that was new, and it takes almost 10 years before every gynae knows how to do it. So this is the same. So I think we need another 5 to 10 years before every gynae can diagnose endometriosis from an ultrasound scan. So the next question, the actual question that this Adiba asked was actually, can you see on MRI scan? My answer to you is again the same, yes and no. I have seen very capable radiologists, because MRI scan is done by radiologists. And very often you send to do a MRI, it's the same. Like a gynae do ultrasound. Every gynae know how to do ultrasound. But when he see, does he know how to look for endometriosis? That is the question. Same with MRI scan. You do a scan, the scan shows the endometriosis, but the question is, does the radiologist who give the report of the MRI scan knows how to look for the endometriosis? That 3 mm, 2 mm endometriosis, can she see it? That is the question. But there are, because I have seen patients coming to me with MRI scans that the radiologist detected spots that are just, we're talking millimeters. But honestly, this type of radiologist is hard to come by. So same thing. So it is not whether the scan can detect, but the question is, who is doing the scan? Who is doing the scan? Is the person doing the scan trained to do this scan? Is the gynae doing the ultrasound scan trained to look for deep endo? Is the radiologist doing the MRI scan trained to look for deep endo? That is the question. Because if she or he is not trained, then your MRI scan or your ultrasound scan is just a waste of money and time. So ultimately, if you belong to a place where maybe resources are limited, you know, like in KL, there's just so many doctors and so many radiologists and so many, you can just jump from one doctor to another doctor, another doctor, another doctor. Eventually you get somebody who can do it. But if you come from a place that is a limited resources, you don't have many radiologists, maybe on less than 10 in the entire town, and you also don't have many gynecologists, maybe 20 or so only the entire town. Sometimes because of the limited resources, it may be quite exhausting going around looking and still no answer. So at the end of the day, you as a patient must suspect yourself at endometriosis. So you yourself must gain the knowledge. You yourself must know how to suspect endometriosis. The signs and symptoms, which I told you just now, there are many more things. There are many more symptoms of endometriosis, honestly, like pain during sex, pain, the same period pain that happens again but it's not period, maybe during ovulation. If you go through all my videos in my YouTube channel, please go through. In different topics that I talk in my YouTube channel, I often insert all these things inside as well, because endometriosis can be found in all kinds of symptoms. Any symptom you can name it in a gynae, you have to also think about endometriosis. And last of all, if you are not pregnant, you also need to think whether you have endometriosis, because 50% of women who cannot get pregnant have endometriosis. And some of these women have no symptoms. All they have is endometriosis. And if you do not suspect, and definitely if you don't suspect, you won't go and do a scan. You won't go and see a laparoscopy. Even if you do a scan, because if you're a fertility case, so many people will have done a scan for you. Just like the case I mentioned earlier. She did so many scans. She has done IVF so many times. Nobody detected her endometriosis. Now her kidney is dead. So even if you have done scan, may not be able to see. You may need to do a laparoscopy. I have also one case a long time ago. I still remember it was a long time ago, almost 10 years back. But now she has 2 kids already lah. So almost 10 years back, she came to see me. And same thing, you check, everything normal one. Scan normal, every month regular period, ovulating nicely, all the blood test is good, sperm test is good, tube is not blocked. And then everything is normal, but she's just not getting pregnant. And she already tried for 3 years. So I told her 3 years. 3 years to me, it's time to do a laparoscopy already. Because already 3 years, you want to know if you have endometriosis. But she didn't believe me, and then she disappeared. She disappeared from my clinic. She never come and see me after that. For many years, she never come and see me. I don't know how many years, probably another 3 or 4 years. And then after that, she suddenly appeared in front of my clinic one day. She appeared in front of my clinic, and this time I scanned her, so many cysts, so many big cysts. I was like, if 3 years ago you do a scope, you wouldn't have this cyst already today. And then when I asked her through that 3 years, where did she go? She went and see other doctors, do IUI, do IVF, and then also went and see the Chinese sensei, TCM, to for fertility, seen this, do this, done that, ate this, still no baby. And now with all the cysts, she came back to see me. And when I did a laparoscopy for her, she was stage 4 endometriosis. Stage 4, that time I was thinking, if 3 years ago you did the laparoscopy, maybe only stage 2, stage 3 lah, won't be stage 4, and then don't have so many cysts, will be better for you. It'll be better for her, even for fertility wise, because if your ovary got no cysts, if we do a surgery for you, then we are less likely to cause any harm to your ovary. Because every time people got cysts, want to do surgery, always worry that we will harm the ovary because they want to get pregnant. But then think about it, 3 years ago, if no cysts, ask you to do laparoscopy, you do or not? So you see, a lot of women not willing to do when they can't see anything on ultrasound scan. But when you can see something on ultrasound scan, then you worry about it damaging your ovary. 3 years ago, no need to worry lor. But anyway, lucky for her, she conceived less than 6 months after the surgery. Because most of my patients, if they can get pregnant, they get pregnant less than 6 months after surgery. So a couple of months after the surgery, she got pregnant. And she's so lucky. She had totally 2 kids. She got pregnant once, and then after she gave birth, she never do anything and suddenly pregnant again, very fast. Couple of months after she gave birth, she pregnant again. So she's very lucky to have 2 kids. And but I always tell women who got endometriosis, your journey of endometriosis do not end with your pregnancy and childbirth, okay? So after that, you still need to make sure it doesn't come back. Okay, so this is one question. Wow, one question also I took half an hour to answer. Alright. Okay, so this is a question that is very important that you all need to understand, yeah? So endometriosis is an invisible disease unless you got your ultrasound scan or MRI scan done by the right person. If it's not done by the right person, it's still an invisible disease. So it's easier to just do laparoscopy because laparoscopy shows everything. Okay, shows everything. Okay, then the next question is by Elaine. Elaine asks, can we request to screen for endometriosis straight away just for general health and not planning for fertility? So her question is, can I just go and do a scan and say I want to check endometriosis? Okay, I think more or less the same like the last question. You can, of course, but you need to make sure it's done by the right person. If not, everybody's scan also will look for endometriosis lah. All of us, when we do an ultrasound scan of your uterus, you will look for endometriosis. But you need to see a gynae for your health test, health screening. Not go to some lab or some health wellness center. You know, there are a lot of wellness center here and there. Even in hospital also there's wellness center. But in hospital, sometimes wellness center, when it comes to the gynae part, they send you to the gynae. The other parts, they send you to other doctors. But a lot of wellness centers do not have gynaes. So when you don't have gynaes, number one, less likely to be able to detect under endometriosis, unless all your cysts big already lah. Your adenomyosis big, adenomyoma big, and then everyone can see. But if you're talking about those smaller ones, a lot of wellness centers will still miss one. So unless you go and see gynae is already more likely to detect, unless it's so tiny that only if the gynae knows how to do deep endoscan. If not, they will not be able to detect. So but normally nobody will put deep endoscan as part of your health screening. So if you're going to just walk in for health screening and you want to have the deep endoscan, I think you really need to request. If not, I don't think anyone will do it for you, because it's not part of health screening anyway, and partly it's because also not many people knows how to do it, so it's not part of health screening. Okay, all right. Or do we have to go through other tests before screening for endometriosis? Normally, no, you don't need to do other tests before screening for endometriosis. Usually, we only look for endometriosis if we are suspicious. Only if we are suspicious. We do not do on everyone. As in, should it be last test after all other screening tests fail to discover the problem? Okay, depending on what test you're talking about. If you're talking about laparoscopy, yes. You have symptoms, you cannot get pregnant, we have done all tests, we can't find a solution to your problem or the answer to your problem, then we need to do laparoscopy. Laparoscopy is usually the ultimate test. Of course, we always leave it as the last test, but it is the ultimate test, because that is the only way we can 100% confirm whether you have endometriosis or not. And number two, we also know how bad your endometriosis. No ultrasound scan can give you exactly how bad it is, although we can roughly tell. Certain signs in the ultrasound, like when we say if you have kissing ovaries. Kissing ovaries means both ovary kiss each other, you know. Ovary is supposed to be one left, one right, but if your both ovaries are in the center and they touch each other, that is kissing ovary. And when you have kissing ovary, we always say it's stage 4 endometriosis. We also can say that you have stage 4 endometriosis if your bowel is stuck to your uterus. If your bowel is stuck to your uterus in the ultrasound scan, which means that I cannot push the bowel away from your uterus, then it's again telling me you have already got stage 4 endometriosis. So some signs can make us suspect, but we still cannot know exactly. And stage 4 also got stage 4 mild, moderate, severe, so we also don't know. So at the end of the day, only laparoscopy will know exactly how bad it is. So ultimately, women who we suspect has endometriosis may need to do laparoscopy ultimately. Okay, not all, but ultimately many will need to do it. I have pain in my back and diarrhea during menses which bothered me for many years. The first thing you thought of it might be endometriosis. Yes, Elaine. Any discomfort during menses, I will always think about endometriosis. So for Elaine, my first advice for her is to try and get a deep endoscan. If you can't find one, you can always come to my clinic. My sonographer is very good at doing that. You can always get my sonographer to do it. A deep endoscan will be able to detect most of the endometriosis already, but I wouldn't say 100%, but it will show certain features that will make us suspicious of endometriosis, unless your endometriosis is like so mild and so little. But somebody with backache and diarrhea during menses, I think your endometriosis may not be so simple anymore lah. So I think it should be able to see in a deep endoscan. So just come and get the endoscan done. Hanisa asks, is it possible to have silent endometriosis? Means no symptoms, regular menses, no period pain, nothing seen upon scan? If yes, what is the odds and how dangerous it is not to do anything? Of course you can. I've seen many, especially with women who come to us just because they cannot conceive. And then we go and do a laparoscopy and then we find endometriosis. And many of these women, when you ask them, everything seems to be normal. There are. But when you ask the question whether how common it is, we really cannot answer you this question. Partly it's because they did a laparoscopy because they cannot conceive. But the majority of women who cannot conceive never had a laparoscopy done anyway. And because this disease is invisible, most of it are not diagnosed anyway. So as a result, nobody knows. We know that 20 to 30% of women have endometriosis. It's because people have done studies on what they call it, post-mortem, dead women. When they do autopsy, that is how they find the percentage. But these women are already dead. No way can I go back and ask them, you got pain ah? Where's your pain ah? No, we don't know. So we know about 20-30% of women have endometriosis. And a lot of times we do see women who do not have any pain at all and they still have endometriosis. Your question is, will it be dangerous if you don't do anything? You don't have pain, you don't know whether you have endometriosis. Does it have any danger? Okay, what are the dangers that we worry? Earlier I mentioned, number one is cancer. Will there be any cancer risk if they have nothing? Okay, one thing about cancer, before the thing becomes cancer, it is usually seen first. Because we have the invisible endometriosis and those that are visible. The visible ones are the ones that are at risk of cancer. The invisible one, no. Normally all those with cancer, they already have cysts, they have adenomyosis, they have chocolate cysts. They have all these things first before these cysts turn cancer. Invisible disease? No. Can women who have no pain got a chocolate cyst and turn cancer? Oh yes, that I have seen as well. She has quite a big chocolate cyst. She has no pain, but it's cancer. So ultimately, it's not the pain, but rather is whether it's visible or not. So if you worry that you can have a endometriosis that you don't know and can be dangerous, just make sure you do your yearly ultrasound scan. Yearly, not do one time nothing and happy for the rest of your life, because you can have endometriosis that is still invisible, cannot see, but may become visible in a few years' time. So if you do ultrasound scan, if you're worried about endometriosis and you're worried that the endometriosis can turn cancer, then just make sure you see your gynae every year just to do a scan. Don't need to do deep endo, just do an ordinary screening scan. Just scan your normal medical checkup, just scan. Everybody can see adenomyoma, adenomyosis, as well as chocolate cyst. Everyone can see, so no problem. Those invisible, the deep endo, they don't know how to see, so never mind, because deep endos are so tiny, they don't turn cancer. Understand? So as long as you do your yearly scan, you don't need to worry. Okay, so I think for today, that's all for today. That's all I'm going to answer for today. There's so many more questions. Okay, so many more. And some of the questions are really very interesting. There are many women who are very knowledgeable about endometriosis. So that is why they actually ask some very interesting questions as well. So you want to know those interesting questions, please stay tuned to my videos over the next few weeks. Okay, let's see why I cannot open your comments. All right. So for those of you who have endometriosis, who are interested in this topic, please stay tuned to my weekly Sunday live videos. So this is a series of videos over the next few weeks, all answering commonly asked questions for endometriosis. Basically, I'm answering your questions on endometriosis. Okay, so let's see what are the questions we have today. Ananya asks, how is it that a woman with invisible endometriosis does not experience any pain. How is that possible? Oh, it is possible. Because why? Endometriosis actually can grow everywhere, but not everywhere is painful. Number one, we know chocolate cyst is not painful. Chocolate cyst is not painful. A lot of women with chocolate cyst and they are in so much pain, the pain is not from the ovary. The pain is from their deep endo, or from all those invisible endo. Chocolate cyst is never painful. Because why? Basically, we need to see where the endometriosis is. Is it at a place that causes pain or not? If it's on some tissues that have hardly any nerves, it doesn't cause pain. Chocolate cysts in the cervix also don't cause pain, because cervix don't cause pain. You know, we can cut your cervix, just cut like that. We do not give you any anesthesia or anything because you don't feel pain. So if you have endometriosis, deep endo in your cervix, you also don't feel pain. Because not every organ in this world, in your body, has nerves. And some, when they have it at the nerve, oh my God, it's so damn painful. Yeah, I did one surgery a month ago, I think just a couple weeks back, not too long ago. She had chocolate cyst and she was operated in Shah Alam Hospital just 2 or 3 years back. She has a lot of pain before the surgery. Her pain was so bad that no painkiller can solve. And can you see her, curl up on her bed because the pain is so bad. She went to Shah Alam Hospital and got the surgery. After the surgery, still the same. She still has so bad the pain, so bad. So when she came to see me, she said, all I want to do is settle the pain. I'm not going to think about whether I can get pregnant or not. All I want to do is to settle my pain. And when I gone in, my God, she has a huge endometriosis. Her endometriosis is so huge, it is invisible still on normal ultrasound scan, although we detected it in our deep endo scan. But when we did the surgery, it was such a big chunk, it was so big chunk, 3 inches long at least, along the nerve. Oh my God. The entire endometriosis grow along her nerve. That's why she's in so much pain. I did a surgery for her during menses. She admitted to hospital. She was in so much pain. After the surgery, no more pain. Because we removed the entire chunk on the nerve. So that is why that happens, okay? So it all depends on where you grow your endometriosis. Chloe Yap asks, chocolate cyst when to remove? More than 5 centimeter remove? This is a very big topic. Maybe I should discuss another day. Is there any relationship for those who have endometriosis pain during ovulation? Yeah, because pain during ovulation is pain around the ovary. So you have endometriosis somewhere around the ovary. Even if you do not see any cyst, there is some endometriosis along the ovary. Endometriosis can recover? Oh yes, of course can. Go and see my videos, okay? Go and see my videos. I have so many previous videos on endometriosis. You'll be able to have the answers for that. Anna asks, is there pain during non-menses considered endometriosis? Yes. The pain that you have during menses and you have it again when not during menses, that is endometriosis. Zilawati asks, can endocyst detect via CT scan? Answer is the same as MRI scan. The answer is the same. Please look at my video just now, this beginning of this video. Is it necessary to have laparoscopy to cure endometriosis to conceive? Definitely. Women with endometriosis come to see me. They say they want to get pregnant. Then my answer is so simple. You want to get pregnant, you have endometriosis. If you cannot get pregnant, you only have one answer. You need to do laparoscopy. If not, you cannot get pregnant. That's it. You want to get pregnant and you're not getting pregnant, then you need to do laparoscopy. If you don't do laparoscopy, then you can't get pregnant. So it's very simple. Pangni Linan asked, Do you exercise endometriosis without ablation? Yes, Jen, I mainly exercise. That's why I told you I took out a big chunk on the nerve. Okay, Ajunta Mala asks, I have done a laparoscopy, was on Lucrine and got my period after 11 months of laparoscopy. It's going to be a year and I got my period with very minimal pain or no pain sometimes. But I'm still unable to get pregnant. Will you recommend to go IUI or IVF? The answer is yes and no. I would ask you to go and do IVF. I will never ask you to go and do IUI. IUI is a waste of money and time and effort. Okay, I will ask you to go and do IVF. Endometriosis women should think about IVF, not IUI. But the answer is no, is because I wouldn't ask you to go and do IVF now. I want you to do IVF now because I want you to get pregnant as soon as possible, because if you don't get pregnant as soon as possible, your endometriosis is going to come back. The biggest mistake of a lot of endometriosis women is after the surgery, they waited too long before they do IVF. But why I would say no is because before you go and do IVF, there are a lot more things you need to settle before you do IVF. If not, your IVF also may not succeed. That is my answer. So it's a yes and no. Can laparoscopy scan endometriosis that hide behind the kidney? They usually don't hide behind the kidney. They are usually on the ureter. That is the one that kills the kidneys. We see it in the laparoscopy, definitely. Nurul Fahana asks, is prolonged menses a symptom of endometriosis? Yes and no. As I mentioned just now, almost every symptom in gynae can be linked to endometriosis one. So it can be, but it may not be. It can be other things also. Anisla also asked, can endometriosis have full recovery? Yes. But you need to do all the right things. Doctor, do your clinic can do fertility hormone or blood check? Yes, Anna. Yes, we do all these things, okay? Endometriosis can only be cured after menopause and after laparoscopy with medication. Thank you very much. Some of you helping me to answer. These are people who watch my videos every week. Okay, thank you very much. Alright, Vivian Ko asked, after laparoscopy, do you need to take any medication? Please look at my videos, okay? Medication is compulsory after laparoscopy. If not, your endometriosis will 100% come back. You now ask, other than menstrual cramp, do regular pelvic pain an indicator of endometriosis? Yes. When you have regular pelvic pain, we have to think about endometriosis. Although not necessarily a must, but it is one of the symptoms of endometriosis. So we need to suspect, yeah? Does endo cause urinary tract infection? Answer to Chloe, yes, because a lot of people, especially they keep getting urine infection, especially if their urine infection usually happen during menses, then it could be a sign of urinary tract infection. Chichi Tan say, because your endometriosis cannot recover even if I do many methods already. Chichi Tan, please go to my video, yeah? Only one reason why you never fully recover is because you never get the complete package of treatment. You need a complete package of treatment. So since today mainly questions are on how to detect and symptoms, I'm not going to talk about treatment, so that I will leave it for another day. Okay, so 1 hour is up. Time is up, so that's all for my video today. So for those of you who wants to know more about endometriosis, please go to my YouTube channel and subscribe to my YouTube channel, because endometriosis is my favorite topic, and that is why I tend to repeat again videos on endometriosis, or even if I talk about other things, I will again and again link it to endometriosis. So please subscribe to my YouTube channel, yeah, and also switch on the notification button, okay, so that every time we have a new video, you will be notified, especially for some of you who are regular YouTube watchers, okay? So go to my YouTube channel, browse through all my other videos, go and look through any videos that is related to gynae, anything, you will always find some endometriosis inside. So when you look at it, you will get more knowledge, so that whenever you ask some questions next week, maybe the question you ask will be better. I would say questions that have not been answered by me. So better you watch all my videos first and then keep your questions for next week, yeah? So okay, so see you again next week, same day, same time, Sunday 9 p.m. Okay, bye!